Hello, everybody. It's Jack Hadley from My Social Practice, and I'm here today with my good friend, Weston Lunsford from Dental Intel. How are you, Weston?
Really good. Happy to be here with you today, Jack. Thanks for having us.
Yeah, thanks for taking a minute to visit with me. And let me set up the purpose of this little stream today. We are about a month away from the Dental Digital Marketing Conference, the fourth annual Dental Digital Marketing Conference held at the Red Rock Hotel and Casino in Las Vegas. And Weston and Dental Intel are one of our premier sponsors of that event. And we've asked Weston to speak, to give a presentation at that event. And so what I wanted to do is just take a minute and have Weston tell us just a little bit about his background for a minute or two, and then I'm going to ask him to just give kind of a high-level overview of what he's going to talk about at the Dental Digital Marketing Conference. So Weston, take just a minute, introduce yourself and what you've been doing.
Awesome. I'm going to be super brief because I don't want to bore people, but
Okay.
we're data geeks here at Dental Intel. And for the last, 20 years, I've been working with the dental and medical field. I've focused heavily on dental in the last 10 years. And it started with me working in a CPA practice and starting a practice and focusing on helping practices improve profitability and making sure that they're in the best position financially for forward looking for their future, for retirement specifically. And that ended up steering into needing more information. And that's where Dental Intel was kind of birthed. We needed more data, and we went through a lot of pain to get information to really be able to help identify areas of opportunities and areas of strength in practices and by specific team members. And so Dental Intel now has been in, business for almost 5 years, but with our product out there for 3 years. And we're working with just over 4,000 dental offices now. We should be approaching 5,000 here in the next few months. And we're super excited about that. So we evaluate. That's what we do. We evaluate a lot of data. We look at trends. We look at what's working. We look at what's not working. And our number one goal is to really take this information and help dentists and their teams do more dentistry. And not even just more dentistry, but better dentistry, helping them identify opportunities to get patients healthier and even more profitable dentistry. So it ends up being a win-win for both the patient and the practice.
That's great. And you know, we've been so impressed over the last few years with the things that you guys are doing over there because they so tightly tie to the concept of digital marketing. And, the whole conference, just for those of you who are watching who are not registered for the conference, and by the way, I'll give you the URL in a minute if you want to check out the conference. There's still a few seats left. But whether you're registered or not, important to remember that the focus of the Dental Digital Marketing Conference has nothing to do with clinical or practice management. It's about growth. And the things that Dental Intel is doing absolutely tie in to the practice's ability to use digital to grow. And so we're very excited about the fit with you and your company and your presentation at the event. So take just a minute, if you would, Weston, and just kind of give us just a high-level overview of what your topic will be at the conference and kind of how that fits into the discussion.
Yeah, well, thank you. And I just want to add to this conference. This is our second year being in attendance here. And man, the energy, the collaboration, and the education that was delivered last year was phenomenal, Jack. So nice job.
Thanks.
I personally am hoping to add to this. And this is about growing practices, growing your patient base, and making sure that you're not just growing patient base, but getting also the right patients in your chairs to be able to do the type of dentistry that you as providers would like to do. And this is both hygienists and dentists and dental assistants and the entire team. You know, I've evaluated a lot of growth opportunities in practices. And so we're specifically focusing on how data can actually help you improve your patient growth and making your marketing efforts really matter. So let me kind of give you a sneak peek of what I mean by that. There's a practice that I work with out of California in Benicia, and he was spending literally over $5,000 a month on new patient marketing. Now, some of you hear that, and that's a relative term. Is that big or not big? For some, it's huge, and for some practices out there, that's not a big marketing budget. But the reality is he was spending this money every single month, and his patient growth was flat. He was getting new patients, but his patient growth was flat. So a lot of his patients was falling out the doors. And here's the sad part about it, Jack. The patients that were falling out the doors, a high percentage of those, in fact, in his practice, it was over 42% of those patients
Wow.
were falling out the back doors, were high restorative care needed patients, meaning they had a lot of unscheduled treatment that was diagnosed. And so really what we're going to be talking about is how team members, you know, you're going to have a mixed audience. There's a lot of different people coming here. We have doctors, we have office managers, we have marketers that are showing up. There's a mixed audience, but we're going to focus on very specifically the best ways for you to grow so that your marketing dollars actually matter. And we want to help individuals understand how to make sure they can use data out of their practice management software today. I want them walking out with very specific action items that they can do within their practice management software so that they can identify the areas of opportunity of patients that are slipping through the cracks, and really not just any patient. Because there are some patients, maybe we can't say this, Jack, but there are some patients that we don't want back in our chairs.
No, you can say that.
Okay, but there are patients we absolutely need to get back in our chairs. And so I'm going to teach those that are there how to actually use the data in your practice management software and identify the patients are most priority to your practice. These are the patients that need the most amount of dentistry, which is better dentistry, which is focused on getting patients healthier, so that when we put our marketing dollars to work, we're not just plateauing. We're not just staying the same. We're actually growing. And that's really key to us here at Dental Intel. And so that's what we're going to be focusing on.
Yeah, that I'm really looking forward to that topic. And you know what's interesting, and I appreciate that you brought this up, is one of the kind of the value propositions at the conference is that we don't just use the kind of the hype of the idea of get new patients, get new patients, get new patients, get new patients.
Right.
Because that's the noise in this industry. And unfortunately, the dental industry has been a target, had a huge target on their back for a long time. And lots of people think, oh, all I have to do is say, get new patients, and dentists come running. This conference,
I lecture, Jack, almost every other week. And I always ask that question, what are we measuring? What do you guys measure?
Yeah.
And I'm telling you, the number one common thing, always collections and productions, but the next item is always new patients.
Yeah.
We've been trained that is a must. And I'll tell you what, I agree, we need it. But we also need to make sure that we're keeping the patients that need healthcare, dentistry healthcare. We need to keep those guys, and we need to get them back in and keep them healthy. And data can really help us identify that.
Absolutely. And this is in no way to say that new patients are not one of the important components of growth. I usually talk about three. Actually, there's four, but I talk mostly about three. It's certainly the acquisition of new patients.
Yep.
It's retention and decreasing the attrition in the practice. And then it's getting the right patients to spend the right money or more money in the practice.
You hit the three that are most critical. And sometimes I think most practices, not sometimes, I know this, a majority of practices don't know how to use the information out of their practice management software to focus on the last item, how to get the right patients. They use patient communication solutions. There's a lot of those out there, and those are just bringing in all patients. But the reality is a lot of the patients that we're adding back on the schedule are patients that are $150 to $190 appointments, which means they need some work, but not a lot of work, when there's a lot of patients out there that are $400, $500, $1,500, $900 patient appointment values. And it's not just about the dollar, Jack. I know that we use dollars to measure things.
Right.
But the reality is if there's a patient that needs $900 worth of work, that patient needs to get healthy too, compared to a patient that needs $160 worth of work. And so it's about prioritizing. And if we're going to spend any time on the phone, I want to make sure that I'm spending time calling the right patients, not just a patient to fill a hole. So we're going to talk about that and empower the team on how to really identify this. Really simple processes that they can do. And I've done this. In fact, I just had a practice that we worked on this in Minnesota, and their results this last week, they're over $25,000 ahead of at this month right now than they've ever been in any month in any history by focusing on this. Their last week, they had the best week of their life because their schedulers are now focusing on better dentistry, not just more dentistry.
Yeah, it's awesome. Well, we'll look forward to your presentation next month, Weston. And for those of you who may not be registered and want to learn more about the conference, let me give you the URL real quick. It's very simple. It's dentalmarketingconference.com, dentalmarketingconference.com, and you can learn a little bit more and kind of see the speakers and the lineup and the information that's going to be shared there. And we'd love to see you next month in Las Vegas. And we'll look forward to seeing you there, certainly, Weston. It'll be great.
Thanks, Jack. Thanks for having us.
Yeah, and real quick, before I let you go, let us know if people do want to contact you prior to the conference, how can they get a hold of you?
The best way right now is if they want to, in fact, for those that are registered for DDMC, and they can show us that they have registered for that, if anyone wants to get an analysis already before they show up to that conference on how they're doing on patient growth and these opportunities that I just mentioned, I will give them a free practice analysis. It'll take 5 minutes to sync their data, and so that they can come to their conference and grab a report from us there. If they'd like to see that, we're more than happy to do that. Best way to do that is to call or just go to our website, dentalintel.com, and fill out See It in Action. And when they get a call from one of my account executives, just let them know that I said during this meeting, those that are going to the DDMC, I'm going to give them this information at no cost. That way my sales team's not going to try to sell them on it.
Good. That'd be great. That's a great offer. And I encourage those of you who are watching who are registered to take Weston up on that offer. So, all right. Thanks, Weston, again for spending the time with me today. And we'll see you in about a month.
All right. Take care.
Take care.
Bye.